We're good? Okay. I'd like to call to order the Public Safety Committee meeting for November 17th, 2022. Welcome to everybody. And I welcome our special guest star, Shauna Black, who's serving here so we can make quorum today. And I believe we have two members who are attending a conference out of town. And I thought they would be on screen. I don't see them yet, but hopefully they'll be joining us. But we do have quorum. So I would like to begin. First item of business is public comment. Is there anybody who wishes to address the committee? I see nobody in the room. Is there anybody waiting on screen? I don't see anybody there otherwise. Okay, any changes to the agenda? We have, I see Veronica has joined us. Good. Or she was there momentarily. There she is. Okay. We have minutes from October 20th, 2022. Could I get a motion? Mike moves. Shauna seconds. Thank you. Any questions or comments on the minutes? Ready to vote? I will call the roll because we have remote members. Shauna?
Yes.
Mike?
Yes.
Veronica?
Yes.
And I don't see Travis yet, so I'm going to vote yes, and that's unanimous. Chair's report. We have a discussion item regarding ambulance. Before we get there, I just wanted to say I attended the Emergency Response Operations Committee meeting yesterday and listened to their discussion. There was one item, but perhaps we could talk about it when we get to the Probation and Community Justice report. And Dan could tell us there's a program coming up on the 30th of November that might be of interest. So why don't we proceed to discussion of New York State initiatives related to ambulance service. And Mike, if you could introduce that, and I believe Rorden Hart is with us to give us some information about New York State possible funding sources. So I turn the floor over. Mike?
Yeah, absolutely. Thank you, Rich. So Mayor Hart is here today. He's been intimately involved in all things EMS at the state level, and he has agreed today to come and give us an update. So I just want to extend my gratitude to him for making time for us today.
Thanks, Mike. Thanks, everybody. Can you hear me okay?
Yes, we can.
Okay, great. If there's anything specific that you're looking for in terms of information, cut me off and let me know. The list of what is potentially going to be introduced in the next session of the legislature is actually relatively long. I did have a conversation with the legislative director of NISAC this week. And so there are essentially about a half a dozen, maybe 8 proposals that are going to make their way through the assembly. So I'll just touch on them briefly and then let me know if there's anything more specific you'd like to know. The first piece is they're looking at special taxation districts. Currently, if you want, or if a municipality wants to launch an ambulance service, it has to be housed within the entirety of their municipality, either through special ambulance district or a city or a village can form one internally, and then any service you render outside of those borders has to be done by contract. They're looking at ways to potentially allow counties, towns, villages, and cities to form joint districts that create brand new boundaries. Sounds like a lot of fun, but creates brand new boundaries and then allow for taxes to be levied for the service within that boundary. You've probably heard about some various property tax cap exemptions. I know that Jay Franklin is working on various types of property tax breaks for individual providers, particularly on the volunteer side. Albany is now considering whether there's a way to allow for tax cap exemptions for the municipalities if their expenses run large for the provision of EMS services. There's a fairly big push from downstate. Our friends in Westchester County and so forth, they have a number of agencies. However, their pay structure is not commensurate with the cost of living in those areas. So they tend to lose EMS providers to police departments and fire departments whenever there are openings, because those levels of pay tend to be higher, as well as they have access to state retirement benefits. So one proposal that Senator Shelley Mayer from downstate has been pushing for fairly hard is to figure out a way, and frankly I don't know exactly how they would do this, but figure out a way to give access to the New York State retirement system for non-state employees. So whether they're not-for-profits or other types of agencies, I don't imagine that would include private sector for-profit agencies, but that's still up for debate. If there's a way to offer state retirement system access to those folks, then perhaps that makes the job more attractive, and they can try to control some of the attrition to police and fire. A little bit inside baseball, there's a proposal that allows for certain EMS agencies to bill insurance companies directly. Currently, you have to be a specific type of provider agency in order to bill insurance companies. They want to expand that. And then, of course, there's the soapbox bill that Assemblymember Kellis and Senator Hinchy are working on together that I helped to write, and that is creating a CHIPS-style funding model where there would be a direct revenue stream from Albany to municipal and not-for-profit EMS agencies. Now, whether that would flow through the counties or flow directly to the agencies still needs to be worked out. And that sounds like, in order to get some traction on that bill, Senator Hinchy in particular wants to package it with a couple of other provisions. One is, I think I mentioned in one of your previous meetings, they're looking at creating a statutory requirement for counties to employ an EMS coordinator, as you already have for fire. That would be the statutory way to make EMS a quote-unquote essential service. There's been some conversation about essential service requirements for years and years, but the question has always come up, well, how do we actually do that? And so just as sheriffs are mandated, fire is mandated, they're actually mandated because of the function of the office that is a requirement. So that was Senator Hinchy's solution, is if we create a requirement to have an office at the county level, then you necessarily are requiring the service to exist. So that's kind of leg number 2 of this stool for this bill that's being worked out. And then the third piece doesn't affect municipalities so much, but it's to figure out a way to generate higher Medicaid reimbursement rates, even including the for-profit providers. That is, quite frankly, a tip of the hat to New York City Metro, as you have a lot of for-profit agencies in that area who will benefit from higher Medicaid reimbursement rates. The concern, of course, is not to shove that Medicaid reimbursement back on the counties. So they want to try to figure out how to work that. So that particular package, the CHIPS-based EMS funding revenue to not-for-profit and municipal agencies, coupled with the county requirement to have an EMS coordinator, coupled with higher Medicaid reimbursement rates, that is going to be introduced in the first part of the next session. I can't speak to the other bills, when they'll be introduced or what horse trading might go on to get support for that, but certainly that last piece is slated for introduction. So that's what, as of Monday, that's the list of items that we have on tap.
That was a remarkably brief summary of a ton of information, so thank you for that.
Sure.
I'd like to open it up if anybody has questions. Seeing no hands raised yet, I had a conversation with Anna Kellis about the CHIPS model. And do you think it would work in combination with some of the other proposals to sort of jumpstart this, or do you think that would be enough in and of itself?
It sounds like there's some resistance to the CHIPS models as a standalone. I haven't quite, well, there are a number of folks in the Assembly in particular who are not as acutely aware of the issue with rural EMS provision as the rest of us are. So the standalone CHIPS type model, Anna did introduce the bill in the last session, and it was hotly debated but received some resistance. And it was primarily, I think, a concern about another state expenditure. There was a sense from some folks that I heard that this is a local issue, and why does it rise to the level of being a state issue? So that's kind of a debate on its own, but by packaging it with some of these other provisions, we're picking up support from the folks who are championing those particular causes. Frankly, the CHIP-style funding model will work with any of these other provisions. It's not mutually exclusive to any of them. We're basically taking care of one specific, although I think it's fairly broad, but one specific concern, particularly in rural EMS services. So packaging it with anything else that will gain support does work.
Commenting on one of the other proposals, the idea of tax exemptions, property tax exemptions for some volunteers, I'm not that thrilled with that one just because it seems to be so hit or miss that you have to own property, and the amount of the benefit will vary depending on how much property you own, and it would certainly skew towards helping people who probably are well off enough to own real property. But the idea of access to New York State retirement or to health insurance for being a volunteer firefighter or EMS provider, that I think has some tremendous power to it, and that would go directly to the issue that we're trying to address. That's probably a more expensive thing, and it's state money rather than local property taxes. Yeah, but yeah, Shauna.
Sure.
Yeah, I agree with you, Rich. I actually, as far as the property tax exemption or discount on that, I would actually be in support of that because I feel like having a multi-tiered way to provide some type of benefit is going to be needed here. But I also was wondering, has there been any conversation about the increase of the Medicaid reimbursement?
Yes, so Medicaid reimbursement increases is something that particularly private sector and, as I said, New York City metro area agencies are highly in favor of. If we think about distribution of Medicaid patients by population, it tends to cluster in urban areas. So your urban agencies are certainly going to benefit. We don't, for instance, Trumansburg EMS, we take calls in a 400 square mile area. I think the number of Medicaid calls we take is relatively low. So that's something as Senator Hinchey and Anna were thinking about, how do we try to develop a package that will have more broad support, have to figure out how to get New York City on board, basically. And I think the Medicaid piece is a big piece. One thing I'll just comment on is a lot of the proposals that still float around in Albany, I guess not surprisingly, if the education level on the issue isn't where it needs to be, still focus on the volunteer side of the conversation. And of course, we love our volunteers and we want to encourage that wherever we can. But in terms of ambulance service, the last time I checked, about 18 to 20% of all ambulance agencies in the state are still volunteer. And that's declining by about 1% or so a year. So yes, we want to try to, no pun intended, stop the bleeding when it comes to volunteer attrition. But as that has already happened, the cost on the paid side is what's just astronomical, as we've discussed. So hopefully the consciousness of that in Albany is improving so that we can get some of these other, whether it's Medicaid or direct funding, we can get some of these other, get some traction on some of these other proposals.
I guess the other question I had was, has there been any conversation about setting up a fund for those that are transported that are uninsured completely?
I have not heard any proposal along those lines. It's interesting you mentioned that, Shauna. This actually came up locally the other night when we were looking at billing rates and charity care policies and the like. And I think, and I haven't seen statistics on this recently, but it used to be back in, say, 2010, 2011, we would consider about a 13% of the population to be uninsured. Some percentage of that some subset of that 13% were self-insuring business owners and the like. But of course, we have folks who couldn't afford insurance in that group. I haven't seen an update since the ACA came into effect in 2012 or 2013 when the exchanges came online. So I don't know if those statistics are available, but if they were, I would be interested to know, what percentage of the population actually carries no insurance now that we have that structure in place. But the short answer is no. I haven't heard any conversation about some type of a backup fund to help those folks out.
Thank you.
I'm curious if there's any parallel efforts to streamline or help fund the training requirements for EMS, because those over the years have gotten much more difficult to stay current with. Is that correct?
They have. I have not heard anything about streamlining in terms of what's required. What I have heard in the governor's budget last year, there were some proposals relating to coordination at the state level with respect to training requirements, the different regional EMS agencies. So, Trumansburg, as an example, our territory actually covers 3 different regional EMS agencies. So that's 3 different sets of requirements, 3 different sets of certifications. And so trying to make that less of a morass is something that Albany could be very helpful with. But in terms of loosening up the requirements in any way on training and certification, I actually think it's going the other way. I think if we get state funding, Albany is likely going to want an even higher level of certification requirement, even more stringent training, just to make sure that in Albany's mind, they're getting their bang for the buck in terms of the skill sets of the providers.
Yeah, that makes sense, but at the same time, it seems to be limiting the number of people that you can rely on. So there's a real trade-off there.
It is, and a perfect example is, we have 2 or 3 volunteer fire companies in Tompkins County that provide EMTs, but they are non-transporting in most cases because of the certification requirements that come with transporting. And there are a couple, including we have one here, fire company members who are paramedics, but they are not allowed by law to render paramedic level care through their fire company unless the fire company is certified as a paramedic level agency. So it becomes very bureaucratic very quickly as to, even if you have the skills, whether you are quote unquote allowed to use them. And that's certainly part of the bigger problem. And I have not heard anything about any legislation that would alleviate that.
Okay. And then of all these proposals, it sounds like you would support the county doing a resolution supporting the CHIPS model with the essential service and the higher Medicaid reimbursement, that legislation, when it comes out in January?
Certainly, yeah. Any support for that would be, I'm sure we'll be hearing from Anna, as well as once we brought Senator-elect Webb up to speed. I'm sure we'll be hearing from them once the bills are introduced. But yeah, that to me covers a lot of bases. If we can have any type, really the issue is not, at least where we live, the issue is not staffing, fortunately. The issue is money. It's just a really, really expensive service to operate, far and away more expensive than law enforcement or fire, and that's because it is a function of the healthcare system. These are, you've probably all heard my soapbox speech. These are mobile emergency rooms with emergency room level providers on board, and the costs to provide that are very, very high. And so any assistance we can get with the view that this is in fact healthcare, any assistance we can get from Albany will cover a lot of ground in making sure that we don't continue to lose services, particularly rurally.
Okay. Any further questions, comments? All good? Okay. Roden, thank you so much for coming and talking with us, and it sounds like there's more to come here.
Sure, you're welcome.
Okay. All right, let's keep going in our agenda. Next item is County Administration. Lisa, welcome.
Thank you, Rich. We have a resolution, and I do have one update, so I'm not sure which.
Why don't we get the resolution through? That's on page 14, I believe, of the packet. This is Resolution ID 11287, and it's related to the Assigned Counsel Program and acceptance of grant. Shauna moves. Can I get a second? Veronica seconds. Lisa, do you want to speak to this?
And Lance is available as well. If
Is he up
you
on
want-
screen?
Yes.
Oh, there he is. Yes. Good. Either one. Please jump in.
Over to you, Lance.
Okay, this resolution pertains to our statewide expansion contract with the Office of Indigent Legal Services, our state provider. This is the final 2 years of that money, and the last year will kind of form the basis of our ongoing contracts after that. This will run through, effectively, we'll probably run this through 2024 into 2025, this money. The significant change here with years 4 and 5 is, as you know, historically, we've never been allowed to use state money to supplant county spending on our program. But in recognition of the changes with the discovery law and the increased work this has created for the attorneys, they've changed that now. So in years 4 and 5, we'll have approval to spend some money directly on attorney fees related to discovery. So for the first time, we're going to be able to cover some of the attorney fees in our program utilizing state money. It'll be a couple $100,000 over spread out over a few years, but it's still a significant, input. It'll help us keep the county costs down moving forward.
Good news. Any questions or comments? Are we ready to vote? I'll call the roll. Shauna?
Yes.
Mike?
Yes.
Veronica?
Yes.
And the chair votes yes. All right, so that's unanimous. Thank you, Lance. And Lisa, other items?
Sure. I just wanted to bring to the committee's attention a topic that periodically arises, and that has to do with youth detention. And just to make folks aware, in October, there was a youth remanded to the sheriff's custody until a detention bed was located. And just a couple of weeks ago, we had we convened an after-action meeting to discuss the situation, because thankfully these situations are few and far between, but when they occur, it places a real hardship on our sheriff's department. So at the meeting, the sheriff and undersheriff attended, along with DSS staff, probation staff, and the county attorney staff, to just discuss the case, and it was a really productive meeting. And I think what we determined in these cases that, and again, I think that in this case, everyone, all of the parties acted to the best of their abilities to serve the client, and the system is just not in place to find housing for youth that require this level of supervision. So in this case, I think it was 2.5 days that the sheriff's department had to provide 24/7 supervision. In the sheriff's department interview room, and then later decided to get a hotel room for that individual's comfort. They couldn't be housed in the bed or in a bed in the jail. It was a situation where the judge remanded the youth to sheriff's custody, and a bed was eventually found, and then the youth had to be transported back to the to the county to appear before the court. So with the issue around finding available detention beds anywhere statewide or even out of state nearby, it's nearly impossible. I think through the meeting we determined or tightened up connections between the various parties and departments involved to continue to do everything we can to find alternative community-based solutions or family-based solutions and safety planning. But in the case, and this is one of those cases where there is no alternative safe solution, we're really stuck. So just wanting, again, to bring to this committee's attention this issue that is not unique to us. It's similar across all of the rural counties. And I think what I felt a next step for us to do here would be to apply some pressure once again to the state, to the OCFS around their actively managing the available detention beds across the state, because larger counties who reserve these beds, even if beds are available and are not used, counties who need a bed cannot use them. And so while it may look on a website that there are available beds across the state for youth detention, when you actually have to pick up the phone and call, there are never any beds available, or very, very rarely. And so I think the active management of those beds, if OCFS is not going to allow us to look into a regional facility together with other counties for this, that they need to be called upon to actively manage these beds. And then the other piece is, while we are on the topic of discussing jail renovations, or public safety building renovations, I should say, having a space in the public safety building for cases like this where youth are in sheriff's custody is something that we should talk about and consider in the discussion.
I agree completely. And when we toured the public safety building last week, the sheriff showed us the area where youth are held. And while it's, sufficient, it's certainly nothing that you would want to use on a regular basis. And I believe as we get to our discussion of the jail, certainly this will be one element. Yeah. Does anybody else have comment on this or questions? This issue of detaining youth? Okay. Yeah, we'll return to it in a few minutes, I think. Okay. Anything further?
No, that's it.
All right. Next item is the Sheriff's Department. And I see Jen is here, and I believe our sheriff is at a conference. Is that correct?
Yes, he's out of state at a conference.
Oh.
He apologizes he couldn't be here.
No, I talked to him the other day, so understood.
You have our report. Our October was busy with community events and training events as well. The sheriff and I would like to thank you for your support in the budget. My understanding is it was passed this week, so we appreciate your support in the 2023 budget. We've been meeting with the mental health department to work on a policy and determine best practices to get the mental health co-response team up and running as close to the new year as possible. So we're excited about that. Next steps, we'll be inviting the 911 center in on the conversations to make sure we're all on the same page. The only other thing is we are currently participating in a pilot program where our corrections exam is no longer the traditional written exam. It's a training and evaluation exam, which means that applicants put in an application and then they detail their work experience, volunteer experience, and other educational accomplishments that they have, those are evaluated and they're ranked on the suitability for the position. So we're excited to see how that program works, that pilot program. Candidates have until the 29th to fill out those applications. So if you're interested in a career in law enforcement, we encourage you to go to the civil service website and apply.
Okay.
And I'm happy to answer any questions.
Great. Any questions for our undersheriff? We do have a resolution I'd like to make sure we take care of. I see your canine unit was active and out in the community. That was good. So some
Yeah, he's Canine Lakers is a hit.
Yeah, it looks like it. Well, at any event, we have Resolution ID 11288, appropriation from contingent fund, replacement pay, and terminal pay reimbursement, Sheriff's Office. Shauna moves, Mike seconds. All right, questions or comments? Seeing none, I'll call the roll. Shauna?
Yes.
Mike?
Yes.
Veronica?
Yes.
And the chair votes yes. So that passes. And we will keep going. Next up is District Attorney. And yeah, I saw Matt there. Welcome.
All right, thanks, Rich. We remain busy. We did a felony trial this week that resolved favorably and the conviction on all counts. Seeing how overwhelmed the law enforcement agencies are, the Sheriff's Office and the Ithaca Police Department, specifically the investigations divisions of both agencies seem to be getting big case after big case after big case and can't stay on top of that. So, we're trying to help them and be as helpful as possible, but it seems to be a trend that I think all the law enforcement agencies are understaffed and overstressed right now. We are working with the group related to production of data for the DA's office and assigned counsel office, and that's moving along pretty smoothly with Dom's leadership and Mona's leadership. So that's something that's important to me, to be able to put out data to the community so they can better understand the system. So that's moving along. Otherwise, I'm open for questions.
Okay. Thank you, Matt. Any questions for our district attorney? Okay, I don't see any. Thank you. I do see Mona Lita is with us, and I should have asked during county administration, is there anything you wanted to share with us, Mona, regarding reimagining?
I think Lisa gave a pretty good update the other day. I will share that we did a data analysis interview yesterday afternoon. So we have 2 candidates that we will be moving forward with checking references. And then I'll be going back up again to the Common Council December 7th to give an update and wait for the vote on the 2022 and 2023 work plans.
Okay. And yes, we were briefed the other day, but it does sound like we're finally making progress on getting alignment on work plans, which is really good news. And I was very happy to hear about the data analyst position. I think that's critically important that we get that person on board.
I agree. So moving forward, I'm excited. So, yeah.
Okay.
We also have the officer wellness group that working group has been meeting and moving forward on some plans on how to, look at different ways to take care of our law enforcement first responders. So we're doing well in that department.
Excellent. All right. Any questions or comments for Mona Lita? No? Okay, thank you. All right, keeping moving, we have Department of Emergency Response. And our first item is review of public safety facility plans. And is Arel with us today? Is he here? Oh, there he is in the corner. Okay. Arel, did you have anything you wanted to say at the outset here?
Well, it was under emergency response, so I was looking for something under the public safety building, but in any case, no, I mean, unless you want me to report on the tour that we did last week,
Well,
I got on a little late. I just got out of a meeting earlier, so I wasn't sure if you covered that.
yeah, just for
initial
anybody who
remarks.
wasn't on the tour, we did not have discussion, but we were able to talk about what are the current conditions. So we did a walkthrough, and we looked at the plans that were prepared before the pandemic, or the sketches for what was possible to construct, and we compared that to current conditions. We also looked at the work that's scheduled to be done in the next few months there, and to try to determine, are there ways to retain the value of the new work at the same time as we would do further work on the building. Is that a fair summary, Aurel?
Yes.
What we did? But this is our opportunity in public meeting to actually talk about what we saw and what our thoughts are on that tour. Does anybody wish to make any comment? Shauna.
First off, I'd like to thank Under Sheriff Captain Bunce as well as Aurel for taking us on the tour. I've been up there a few times, and it's always good to see the facility and to see the people inside. I am glad that we're investing in doing kind of the Band-Aid things that we need to do in order to make it more habitable. I think I continue to be sticker shocked at the cost of the pods as we talk through it. And I know that we've had mention of regional jails, which sounds like that might kind of be a dead end. It might not be something that's available to us. But I think as far as spending $40 million, $20 million on pod systems, I would have a really hard time doing that. I do, however, like the layout of all the extra, the medical rooms, the activity rooms, and I do hope that, you know, maybe there's some compromise that we could have that would add some of these common spaces that would make it easier for our employees as well as the people that are in our jail to receive services. I know this is just the beginning of the conversation that I feel like has been going on for about 10 years.
Well, as Aurel pointed out, actually since the late 1990s.
No, that's right. Decades.
Yes.
So.
Well, thank you. I guess my comments are I share the concern about sticker shock completely. This is going to be a really expensive project, no matter how you try to work around and reduce the cost. It's still going to be a big number. What I think we found, though, is that as we wait, that number just seems to go up and up and up. And the longer we wait, the more deteriorated becomes the condition of the jail. And I think at the very least, what we owe the public is to make a clear decision saying, we've looked at it, we're not going to do it. Or, okay, we're going to do this, let's look at the bonded cost and how can we manage that bonded cost. I think there may be something we could possibly do, not on a regional jail, but on a contract basis, to perhaps guarantee a revenue stream for a jail with another county that would then not have to build a jail. You know, but that's a further conversation to be had. To prepare for this meeting, I did a draft report that is essentially a modification of the document we looked at before with the different types of functionality that we had talked about we would like to see at the jail, such as more classroom space, a better medical facility, you know, reconfiguring the control room so there's direct access so you don't have to get into the secure space to get to the control room, a pod system, and trying to do it in a way that would save as much as possible from the current building and not moving these perimeter of the secured space as far as possible. However, those are really questions for facilities and infrastructure. And I think that's essentially where the decision will end up being made, whether this is just too expensive or not. the brief we undertook for our work plan this year was to make those decisions about what functionality we want to see and what kind of jail we want to see in terms of our needs and what we're trying to do in terms of dealing with inmates and protection of our corrections officers. So at any rate, I have prepared a draft report that outlines, here's the functionality changes we would like to see. And I've prepared a draft resolution saying we recommend that facilities and infrastructure review these functionality changes and determine what the design options might be, and to get some estimated costs for us to make a legislative decision as a whole. I have those in draft. I just wanted to talk about them today, but what I'd like to do, if this is the consensus of the committee, is give them to everybody, and we intend to vote on it in December. So we have a full month to think about it and make sure the recommendations coming from public safety to facilities and infrastructure are what we want to do. Jen, I see your hand.
Yes, thank you. While I know the main focus is the jail, I appreciate Lisa's distinction that it's the public safety building. I just want to remind people that this discussion also entails our road patrol division and our civil division. The current structure we're in is very limiting to the initiatives that we want to take on and that we have taken on, i.e. the sheriff's clerks. They're currently, we had to evacuate one of our evidence rooms to give them room to operate, starting this mental health co-response, which I am excited about, and I anticipate it's going to be a successful program and perhaps expand. We have no position for that, those teams to work out of. Our female locker room is very small, and I'm happy to say that we're getting more female applicants and corrections officers and deputies to come in and work for us, and I'd like to have space for them in the locker room. So while I appreciate the concentration of it is going to be on the jail, I just don't want to lose the sight that it also includes road patrol and civil as well.
And I apologize because I misspoke in saying it's jail. The report I have drafted does include both jail and the whole public safety building. Certainly the emphasis is on the jail, but the impacts cross over, and there's specific things. What I have in here that would impact the public safety side is the centralized arraignment part, that we need to get you guys back your briefing room, and a holding cell for the cap, so that would work better, and trying to build that in a way that addresses the issue Lisa raised about how do we safely and effectively hold a youth while we're trying to get New York State to actually address that issue appropriately. And then I also have something in here about the locker rooms, that when we toured, Jen, I think you said that state law requires there be parity between the men's and women's. And right now, the women's locker room is far smaller. And so we would need those to be equal to each other. And I also added, if financially possible, an exercise room, because this seemed to be such a core thing to the Shenango facility we toured. And physical fitness is such a key element of both being a deputy and a corrections officer. So
yes,
those are in there.
Highlighting that, Rich. And Mona could speak to this. She has seen the results of the officer wellness survey that we put out, and I would say 85% of the employees that responded highlighted that an exercise room or access to a gym within the facility would really increase their officer wellness and ability to do the job.
Mike, did you have something? No. Let me, Dan, go ahead.
I just want to say that the access to a gym for law enforcement I mean, there's plenty of gyms around here, but it's difficult for them to find ones that are open. And it's also difficult for them to try to work out and focus on that, where they may be worried about running into people that they've arrested or had issues with in the past. But also it's injury, it reduces the risk of injury if people are physically fit and less stressed. So I think it would be a great thing for the sheriff's department.
I mean, it again goes to this question of overall cost. This is going to be a big number, but if we're going to do it, our brief was to address the functionality side. So I think at this point we want to include it and look at designs that would have that there, and then circle back to, is this number just too high for us? In terms of a pathway forward, does this make sense? And I guess I'd poll the committee members. So we're not deciding, is it the number yet, as Shauna indicated. We will be shocked by this number, but do we want to go through the exercise of having facilities and infrastructure, look at our functionality recommendations, and look at designs and estimated costs? Shauna says yes.
I'd say yes.
Veronica?
Yes, sure. But I'm confused about what we're saying our functionality recommendations are. Or are you suggesting we decide that next meeting?
Well, I can certainly run through the rest of them. And I can do this as quickly as I can, but I have construction of a pod, which it would be the largest ticket item of any renovation. It would be designed to replace the current bed count that we have now, not to increase the size of the jail, but to reconfigure it so that they would be in a different environment. Medical facility, make that bigger and more functional. I have in here detox crisis stabilization facility that would mirror facilities outside of the jail so that somebody who's going through detox or crisis stabilization could begin those services in the jail and hopefully seamlessly transition into treatment outside of the jail. That would probably be connected to the medical facility. The work to get a CAP, centralized arraignment part courtroom, continue that at the jail or at the public safety building, and a holding cell for the CAP that includes perhaps an area where we could hold youth, programming, classroom space, so that we would increase the single room that we have to several. We'd probably try to reconfigure the dormitory space that's existing and is in the secure envelope into programming, classroom space. Library, inmate belongings storage, there just isn't enough space at present. Lawyer meeting rooms, visitor facility, that's perhaps adequate, but we should look at it. The kitchen with the current work to be completed, I said the kitchen should be sufficient, and laundry with the current work to be completed, the laundry facility should be sufficient, but I would invite comment on that. We want to retain the outdoor facilities that were upgraded a few years ago, and I have in here transitional housing space, and that may be something we don't want to have in the jail, but to make sure that people don't go from the jail to an unhoused situation, and particularly if they're susceptible to overdose. We should have some transitional opportunity. And then the control room to reconfigure access, and then the issue I spoke to regarding locker rooms. Is there anything else anybody sees that should be addressed here? That's a lot. This would be a major functional renovation of the jail. Does that answer your question, Veronica?
Yeah, at least some of it. Did we talk about transitional housing space and I'm just forgetting about that?
It was in the memo I prepared a while ago, but that may get tossed out. What I'd like to do is share this draft report with everybody and rip it apart. Let's be prepared in December to agree to what should be in there and what shouldn't be in there, and hopefully pass a resolution to send that report onto the Facilities and Infrastructure Committee. And I see, Ray, you're with us. Do you have any comment at this point? We're talking about a lot about you. Oh. There you are. Oh, we can't hear you.
Wait, I can't hear you.
You may need to reconfigure your microphone.
Can you hear me now?
Yes.
Okay. Sorry about that. Some of those things that you were suggesting, Rich, I would just put out there that there's, it's not just about facility. You'd be talking about staffing as well, with a lot of those things. Different kinds of housing and, you know, an intensive treatment or something like that, whatever you said with the detox unit. So you'd have to talk about medical and staffing and, you know, what we're going to be doing for all those as well. So I hope the committee thinks about those. One other thing that, you know, you talk about a reconfigure of the current facility. I often wonder if an entire new building put together would be cheaper than doing a retrofit to an old building. And I'd hope the committee would consider those things. I just feel, you know, there's a lot that comes into it if you are doing a construction project in an operating facility. That becomes very staff intensive. We're going to talk about board outs and, you know, what are we going to do with our inmates in the meantime while if we're demolishing one section of the jail and, you know, don't have that access anymore. You know, I think that would put a lot of time and everything else on the project if that was to go that way. So just some stuff to put out there for thoughts.
Okay, thank you. I'm sure we will talk about this at our December meeting. I was making the rounds of the room. I think Shauna and Veronica said, yes, let's proceed in this manner. Mike, do you think that's sensible?
Yep.
Okay. All right. Veronica, go ahead.
Can someone remind me, do we have a like rough, maybe kind of sense of what the timeline of like making this decision and getting the money and doing the construction work and all this might kind of look like?
That's in the draft resolution. That's up to F&I. We don't have to worry about that. They would be getting design services. They'd be getting construction estimates and a timeline.
Okay. I guess one reason I'm asking is I'm thinking about like the one of the pieces that came up was having, for instance, somewhere, sorry about the background noise, to detain youths, but this, like, it seems to matter maybe how that might intersect with the timeline of the state changing its policies if they were going to do that. Or is this just like an unknowable and...
To some extent, it's unknowable. I think what we can think about is the cap court needs some sort of holding capacity. And if we can create a dual use space, if you're going to hold a youth, it has to be separate in sight and sound from any inmate in the jail. And so it might be possible to design a holding cell for the cap space that could hold a youth when in those very few instances where we end up holding a youth, but in day-to-day functions in a different capacity. That's what I was thinking, but again, open to comment on it. All right. Anything further on that? We will have a lively discussion in December, it sounds like. That's good. And I will get that draft out to everybody after the meeting. Anything further for Department of Emergency Response? Michael, we kind of jumped on your report to talk about the jail.
Thank you, Rich. Just a few brief comments. First, I also want to extend my thanks to the Public Safety Committee and the Legislature for their support on the 2023 budget, especially with our new initiatives. So we deeply appreciate that. I also am grateful that you invited Mayor Hart to join us today. I think it was a great briefing. So I know he's already left the room, but I just want to extend my gratitude to him again for taking the time to speak with us. Also just want to say thank you for recognizing Zach Eady, the last legislature meeting. I think that went over really well and had a great impact, not only in Zach, but the entire team. I also want to let you know that we're experiencing a slight setback with the backup center. Specifically, there's a delay in some equipment in addition to the transfer of the 911 lines and the refresh of our 911 phone line system will be delayed probably into the first quarter of next year. The software package that we use for that system is going through its own upgrade, and the vendor is just not going to be able to meet the mark that they initially set for us. And then lastly, I just want to just share that in December the 6th, the Department of Emergency Response will be facilitating a triage tag exercise with all of our county EMS partners. And what a triage tag is used for is during a mass casualty event where you can quickly go through a large number of victims and triage them using a specific standard so that you can decide who goes to the hospital and when and which hospitals they should go to. We've gotten a tremendous amount of support from our local EMS partners. We're really excited about this, and I'm really excited to share the results of that exercise in the December meeting. Thank you.
Questions or comments for Michael? Michael, I at the EROC meeting yesterday, I thought there was a very interesting discussion about the change in technology regarding the cellular phones. And I was hoping you could just clarify for me. I thought I understood that 911 calls from landlines, if there's a hang up, there's generally a response sent out in any event to just make sure everything is okay. But that's not done with 911 calls from cell phones right now, but that might change. Was that what I was hearing yesterday?
So what John Halachek was touching on is that the technology that we use to try to identify an abandoned 911 call made from a cell phone. So just for everybody in the room, an abandoned 911 call is when someone calls 911 and then hangs up. And then there's a protocol that we follow to try to reconnect with the caller just to ensure that they're not in any distress or experiencing an emergency. But because they're using a cell phone, their exact location isn't necessarily known. And our existing technology could create a perimeter of where that particular caller could be calling from up to 300 meters. And this newer technology will allow us to drill down to nearly 20 meters. So that's what he was touching on. But we do get quite a few hang up 911 calls. I think people would be surprised at the number. It's in the thousands, tens of thousands. So it's something that our team gets really good at managing, and quite often only a small percentage actually requires a law enforcement response to check on the caller, because we're able to call back and go through a protocol to ensure that they're safe.
Yeah, okay. I thought that was pretty interesting, and certainly a good development if we could geolocate in an emergency.
Yes, and Rich, just so you know, that is part of the greater backup center, program. As far as upgrading a lot of our existing technology, and that's part of it. And so that is a phase, and that's some of what John was talking about yesterday. Is some specific programming that we're introducing now to the 911 center.
Okay, and I also just had some comment on your TomStat report. It does seem like we continue to trend higher in overdose poisonings than the average, which is certainly unfortunate, but given the issues going on in our community with fentanyl and other drug use, I guess it's not surprising. I see trespass, the average is 73, and we had 136 reports, which suggests something statistically meaningful, it seems like, for that month. And then domestic disturbances are quite a bit higher, or were for that month.
And just to touch on the trespass, I mean, I don't know the specifics of that. I could find out for you if you'd like, but sometimes what could happen is you might have a number of people at one call, and just because of how it gets coded, it could make it look like multiple incidents when it's really the same incident, but maybe a dozen people. And that
Okay,
could, you know,
lots of
sometimes give,
trespassers. That makes sense. Okay, I'm glad I asked. All right. Okay, anything further for Department of Emergency Response? Seeing none. Okay, let's keep going. Department of Probation and Community Justice. Welcome. I see Dan is with us. Is Carla here?
She's also with us, yes, Rich.
Oh, there she is. Yep.
Good afternoon, everybody. Just wanted to give an overview. Two of our stated goals for 2022 were to engage in implicit bias training as a department, and also trauma-informed training, which we've already done the implicit bias, but last Thursday the entire department attended an trauma-informed probation department training. It was very good. I think we learned that we're in pretty good shape in that area, potentially ahead of the curve for probation as a field, but still always looking for ways to improve that. It was well received by the department and has created a lot of conversations moving forward. One of those conversations was about the trauma in this time of year, especially for law enforcement. We always see an increase in people struggling through the holiday time. That extrapolates out to more crime, more people in crisis, and with our law enforcement partners being shorthanded, a smaller number of people this year handling an increased number of traumatic events, and oftentimes with overtime not getting much of a break from going from trauma to trauma to trauma. I had heard, and I wanted to commend Shauna for doing a ride along with bangs, and seeing firsthand what a Friday night looks like for an EMS agent and for our law enforcement. And as part of that conversation, Carla was able to secure a speaker to come speak with us on November 30th. He speaks about trauma, suicide prevention, mental health for law enforcement, as well as service members, fire and EMS. We were able to secure him to come speak with us. I appreciate Lisa agreeing to let us spend some of our training budget to acquire a conference room at the Marriott so that we can accommodate more folks than we would able to accommodate over here at the Human Services Building. We've extended an invitation to every law enforcement agency in the county, to fire and EMS, to veterans, in case JR has people that he would like to refer, and also invited the Tyler County Probation Department to send any officers that they may have. I know it's a little bit of short notice, and with everyone being short-staffed, it may be difficult for agencies to send as many people as they otherwise would like to, but that'll be 9 o'clock to 11:30 at the Marriott Conference Room here in Ithaca on the 30th of November. Also have 4 staff who have been accepted into an instructor development course. It's a 2-week course down in Binghamton. A very difficult course to find, but it's the prerequisite for being able to become a certified trainer in many genres of probation-specific and law enforcement training. So we're excited about that. It's very cost-effective for us because we don't have to put people up in hotel rooms, and these are usually in, 2 weeks in a hotel room for 4 people would be a lot of money. They're usually in Albany or Buffalo, and we found one in Binghamton that's $50 a person. So we're going to be sending 4 officers to that, and the benefit to the department will be we will have certified trainers here who can then go and train other people in the probation field, as well as do internal trainings ourselves. Also wanted to speak a little bit about the monthly snapshot that we send out. It's in your packet, but just to explain, I'd spoken before that we were starting a pilot where we were including community service hours in orders and conditions of probation for all offenders that qualified. So that would be anyone who was nonviolent, not a sex offender, and physically able to participate. So you'll see a jump in our statistics in that area for SWAP, which is Service Work Alternative Program. It's our supervised community service program. We're averaging about 8 people a month getting ordered to community service. In August, that went up to 14, September to 18, and October to 34. So we've quadrupled our number of people being referred to the community service program, which translates out for those individuals into learning skills that may help them become employed, giving back to the community, and working for our not-for-profits in a supervised setting. So, other than that, the numbers have stayed fairly consistent with a slow uptick in new probation cases and new investigations. But things are going well here. We do have, my last comment, we have a 37-year employee who will be retiring in December 15th, Jan Gorovitz, who's been the lead in our family court unit for as long as I can remember. We've promoted Gladys Larson to that position, so she's learning as much as she can from Jan. And we will be having a going away. Jan didn't want a big to-do, but on December 15th, her last day will be, on November 30th, after the speaker in the morning, we'll be having a gathering for her in the day reporting program. So if anyone's interested in coming to that, feel free to come and wish her well.
Lisa.
Dan, could you repeat the date and time of that?
Yes, for Jan, it will be November 30th at noon at the day reporting program.
And the program on trauma training is 9 to 11:30, correct?
Yes, and that's at the Marriott conference room.
Well, thank you for sharing the news about Jan Gorovitz. That's a long career and a meaningful one.
We have a photograph of her when she started here as an intern. So she's actually been here longer than 37 years. And she looks like a high school kid. And she's held up pretty well. We're proud of her. She's done.
Okay. I did have a question about the ES chat. You were introducing those for probation officers. Is that underway? Or is that operational?
Yes, we've actually had ES chat for 5 weeks, I believe. We have 5 licenses, so the people that have that are all myself, Carla, and 3 supervisors. That gives us access to all the radio transmissions we can receive and transmit from our personal cell phones.
Are you finding
the officers themselves have handheld radios that they are taking into the field? We did a 3-week trial period in October where people were uncomfortable with it. It sort of felt unnatural for us to be calling in and out on radios. So for the first 3 weeks, we were not on the system with the other law enforcement agencies. We sort of dispatched ourselves to get people a little bit more comfortable with it. And then on November 7th, we went live on the actual Department of Emergency Response system, and we're all of our home contacts, field contacts are entered into the CAD system. We call in and out of all of our contacts.
Are you finding it useful?
The feedback I'm getting, we had a full staff meeting today. One of the concerns we had was that it was going to be upsetting to clients as it being a change for them, seeing us with radios, hearing us with radios. We've had no complaints from any of the clientele at this point, and it's been very well received by the probation officers themselves. I'm hearing that they feel much safer, much more connected, and it's been wonderful. I want to thank Mike and Chief Harlan McEwen for all their efforts in getting us hooked up, as well as all of Mike's staff have been wonderful. John Stevens, Eldon and Chris, they're anything that we've needed. They've reviewed policy for us. They've troubleshooted. They've come down here and done presentations to really get us up to speed. And I think it's been a success to this point, which I think hopefully we're able to continue and expand upon.
I'm very happy to hear that. I think that is an important safety step. So great. Yeah.
Thank you for your support.
Okay, and I'm also very happy to hear about the SWAP program growth. That was one of the alternatives when I was very young in my career. SWAP was a really active part of probation, and it's good to see it gaining participation.
Yeah, thank you very much. COVID was a real hard hit because we had to shut SWAP down a few times. So it kind of got off people's radar, and the judges were used to not seeing it. So this has been a real shot in the arm for that. And we have just so many sites that we can utilize the community services at. And the feedback that we get from clients when they're done is they find it very rewarding and satisfying. And, it's a nice feeling to know that you've given something back and, made some contributions back to the community.
Absolutely. Finally, I've lost track of it, but you do you participate in that annual program with the judges, the district attorney, assigned counsel. Is that coming up? Is that a December program, or is it now at a different time of year?
Last year, I believe we did it in January, and we're working on one for February this year.
Great. Okay. Anybody else have any questions for probation? Okay. Seeing none, we'll keep moving. The assigned counsel program, and I see Lance is with us. Welcome.
Hello, everyone. Most of my updates were already covered. We went over the resolution and our money, and I think people have covered pretty much everything else I had to cover. Just one other little update, because we've talked about this in the past. Over the past, I guess, couple months, we've been able to add 3 attorneys to the panel. One primarily in family court, does a little criminal work, but has some conflicts there that limits her. We have another one doing some part-time criminal work, and then another attorney kind of fully engaged in criminal work. So that's a good addition this fall for us.
Yeah. How are we doing at staffing the larger panel?
We're okay. I mean, we face like a lot of organizations, we have a lot of people that are going to be approaching, in the next few years, are starting to think about, cutting back, retiring, and so forth. I think like a lot of society, over the last couple of years, we've lost a lot of our more highly qualified attorneys to institutional positions, which relates back to the rates and, income issues. We're holding our own. The major solution is going to be the change in rates that's overdue. What occurs there in 2023. If that occurs, then we'll be able to take some steps to address things in terms of replenishment or be more effective at it.
Yeah, this does seem to be a perennial, almost there situation. Hopefully, 2023 will get us there. If the New York State Legislature doesn't address this issue, what do you see as our alternatives?
I think, well, let me give you a fuller update, because I think the issue, frankly, will not be the legislature. It'll be the governor's office in terms of an effective resolution, because I think the legislature's already on board with raising the rates and having that cost carried by the state, where they were at least in 2022, and our early indications are nothing's changed at that level. We'll have to see with newly elected members where they're at. There will probably be increased litigation. I think that'll force that. The background of that, the Hurl Herring legislation that produced the Hurl Herring settlement that we're, peripherally tied to in Sigler County, they've filed over the course of the last 6 months the notices that the state's in failure of the settlement agreement due to the failure to raise rates. I mean, that's the factor they focused on. So they're ready to file and litigate. I know there were negotiations going on with the governors, the executive. So if that's not resolved, you'll see litigation there. You're going to see probably more upstate lawsuits. So I would think those will, either those or legislation will produce some type of impact on rates in 2023, is my guess. If you didn't have resolution, if it for some reason that nothing occurred, then long-term it's not a sustainable process. We're going to see right now our county court judges, to a lesser degree city court judges, are signing enhanced rate vouchers. That'll continue and probably expand. We've contained that within our budget for 2022. If that continues long-term into 2023, by the end of the year, it'll become more of an issue. I mean, it's not sustainable at the current rate forever. There's going to be some type of implosion in another year or so going into 2023. I'm still hopeful, given everything, there will be a resolution one way or the other, either through litigation or legislatively. I anticipate a resolution at some point in 2023.
Okay. Any questions or comments for Lance on the issue of rates and staffing at assigned counsel? Okay. I had one thing. I think Matt shared with you a report that he received from Cuyahoga County and from their assigned counsel program. I thought it was a pretty interesting report. I was wondering if in December we could talk about whether that's something we could develop here in Tompkins County.
We do. We don't collect and publish those attorney numbers. I can tell you, if you want to go on that direction, it's going to have a very negative impact on participation on the panel.
Okay.
I mean, if people want to foil that stuff, they get it. Some of those numbers we already kind of put out, but we've never published it's available there if people want to go look at it. They can foil it. Some people have. I can tell you, discussing that will be a very negative impact on our panel. Attorneys will be rather offended at that and could change participation rates. I'm just putting that out there.
Yeah, I'm not sure we would want to go down to the level of naming the attorneys, but I thought it was interesting, the average cost for a misdemeanor, the average cost for parole violation, for felonies.
Yeah, no, that information is there, and I'm happy to discuss that. One of the things we'd probably try to segregate it a little more, because and frankly, our numbers will be higher than Cuyahoga County's, which frankly reflects more effective and active representation from my view. But we can provide that. It'll take some work, and we'd have to provide some discussion with it to put it into context, because we'd probably break it down a little more in types of cases and so forth to explain why some things are costing more than others.
Okay.
But no, those are things I think that are sure we can engage on, so you can see what's going on there.
Yeah, maybe we could talk offline on that.
Yeah.
And then come back to it at the December meeting and bring it up again there.
Yeah.
But I did like the idea of a report that sort of quantified the activities of the office. But I agree with you, we would not want to name and shame particular attorneys. I think that would have a negative impact.
Yeah.
Yeah. Okay. Anything further from assigned counsel? We are well within our time. Is there any other business before the Public Safety Committee? Oh, Jen.
Yeah, I just wanted to highlight one of our former employees who started as a corrections officer with us for several years and then transferred to become a deputy sheriff for us. And then last year at some point he transferred to the City of Ithaca Fire Department. Recently he had an accident where he fell out of a tree stand and suffered a spinal cord injury, which has rendered him immobile. So we've started a spot fund. A spot fund has been started, not by us, but by family. But the link to that fund can be found on our webpage as well as Ithaca Fire Department's webpage. So the costs are going to go to help with medical expenses and continued costs. So I would just encourage people to take a look at it. He's provided service through a variety of different departments for this community for a while, and hope we could be there for him.
Thank you for bringing that to our attention. Yeah. Okay. Anything else before the committee? I get a motion to adjourn. So moved, seconded, all in favor? Show of hands. We are there. Thank you, everybody. We'll see you in a month.
Thank you, Rich.
Recording stopped.